Hello everyone, Dr. Jason Weth with some ideas about arthritis, about bone-on-bone arthritis, chronic knee injuries, chronic hip problems, back problems. It's this wonderful therapy called Prolozone Therapy, and here's how I was introduced to it. I had a patient that was coming in the office that was getting adjusted consistently, but the adjustments just really didn't hold. And he went and saw a doctor in Nevada that did a Prolozone treatment on him. It helped to stabilize the ligaments so that the adjustment hold, and he told me about it. I went and learned from this doctor about how to do this amazing therapy that helps with arthritis. Now, most of the time when people have arthritis, it's really like they have a rusty hinge. The joints don't move very well. You get chronic inflammation into the joint. It hurts to do activities of normal daily living. It can be inflamed, it can be hot, it can fill up with fluid. I mean, all of these things are associated when there's not enough space in between the joint surfaces. Now, typically the medical treatment for that is they do a series of cortisone therapy, or eventually you may end up with some type of surgery, a hip or a knee replacement. And this isn't an anti-medicine video, but there's so many things that you can do before you have to get surgery. Now, one of the most common things medically they do is some type of cortisone injection or maybe a Synvisc type injection. And I like to tell people, I'm kind of joking and kind of serious when I say this. If you're driving down the road and you look down in your car dashboard and you see the oil light come on, you know something that is going wrong with the car. And the medical community gives you a piece of black electrician's tape, you put it over the oil light, and voila, you have no more oil light problems. Common sense tells us that we're going to end up with a major overhaul if we don't fix the problem, and this Prolozone therapy is a fantastic way to fix it before you need a great big overhaul. Now, what is Prolozone therapy? It's a proliferative therapy using vitamins and minerals and some oxidative medicine that actually make the tissues heal. So it's actually a semi-permanent restorative type therapy. So here's how you do the therapy. You take a little syringe with a little tiny needle on it, and you can actually take a vitamin solution and inject the joint surfaces, inject the ligaments, and inject the muscles around the area. Put in the building blocks, and you tap into the body's restorative medicine abilities. Now, when I talk about restorative medicine, if you bump up against something and you get a bruise or you cut yourself, the body sends the immune system and the healing cells to that area to heal up the problem. Now, the same thing happens when you get a new stomach every 10 days, you get a new liver about every 3 months, you get a new bone system about every 6 months, and proliferative therapy using oxidative medicine, the Prolozone therapy, just taps into your body's ability to heal itself. It's a little bit different than taking an oral supplement like glucosamine or chondroitin or papaya or bromelain or any of these natural over-the-counter medicines or therapies for joint pain, because this actually puts more of the building blocks directly in the area. I think it works a lot better. Now, I haven't had any problems with contraindications. I love using this natural approach because the worst thing that usually happens with people is that they stay the same. You can't make people worse. There's no side effects. It's not like putting cortisone therapy where you can't do as many treatments as it possibly needs because it knocks down the inflammatory systems and it actually can damage the bones and the ligaments. I've had people where we've been able to do this repeated times over the last 10, 12 years, and we don't have any problems because we're just putting natural things into the area. Some really, really neat outcomes of people that can't walk upstairs, they can't throw a baseball, they can't golf, they can't fish, they can't garden, and we do this restorative therapy and they get their life back. Now, what's really neat about this is it's really cost effective. Usually the treatments are anywhere from $150 to $300, and so if you're looking for a healthcare provider that's doing this, that's usually the price structure that you're looking at. You're looking at about 3 to 5 different treatments, and then usually you have to do a follow-up treatment about every 12 to 24 months. So it's a really neat long-term solution where you don't have to use drugs or you don't have to use surgery for your arthritic conditions. Hey, thanks for watching the video. If you'd like more information, education, or want to work with us, head over to bestmedicaloptions.com. And if you want to help to reach, teach, and heal the world, leave a comment, like, share it with someone that you love. It may seem like an impossible task, but those that are crazy enough to think that they can change the world are the ones who do.